Imagine facing one of the most profound decisions in life, a moment when medical terms become critically important, shaping the path forward for a loved one. Understanding these terms, especially in the context of critical illness, can bring a much-needed sense of clarity and purpose during incredibly difficult times. Brain death profoundly impacts end-of-life care decisions because it signifies the irreversible cessation of all functions of the entire brain, including the brain stem. From a medical and legal perspective, this diagnosis means the person has died, shifting the focus from treatment aimed at recovery to decisions regarding organ donation or the respectful withdrawal of medical support. The core reason brain death is so definitive lies in its medical definition. It is not merely a deep coma or a persistent vegetative state, which involves some preserved brainstem function or the potential for recovery. Instead, brain death confirms the total and permanent loss of all brain and brainstem activity. This includes the automatic functions vital for life, such as breathing, consciousness, and response to stimuli, which are centrally controlled by the brain. The diagnosis is reached through a rigorous series of clinical examinations and, often, confirmatory tests, ensuring absolute certainty before such a grave determination is made. When brain death is confirmed, the immediate actions for families center around two main pathways. One path involves discussions about organ donation, where the deceased wishes or the family's decision can offer life to others. The other pathway involves the dignified withdrawal of life, sustaining medical interventions, aligning with the understanding that the person has already passed away. This crucial period calls for open communication with medical teams to understand the implications fully and to make choices that honor the individual's values and previously expressed wishes, if known. Understanding the legal framework, like the Uniform Determination of Death Act, often referred to as UDDA, in many jurisdictions, provides further clarity. This act legally equates brain death with cardiac death, confirming that once brain death is declared, the individual is legally deceased. This legal recognition supports the medical community and families in navigating these complex decisions with established protocols. Moreover, having an advance directive, such as a living will or medical power of attorney, becomes incredibly valuable here, as it can explicitly state an individual's wishes regarding life-sustaining treatment and organ donation. Ultimately, grasping the precise meaning of brain death empowers individuals and families to engage in more informed end-of-life planning and decision-making. It transforms what could be a deeply confusing and agonizing period into one where choices, whether for organ donation or withdrawal of support, are made with understanding, respect, and a clear recognition of the medical and legal realities, thereby ensuring dignity and honoring a person's legacy.